Good evening, Lou Alice. It's nice to have you with us tonight.
Nice to be here.
Well, thank you for coming to talk to us about your dental implants. Before we talk about your implants, I think that we have a lot of people who are interested in knowing about what prompted you to investigate them. Tell us a little bit about your dentures.
Well, I couldn't chew.
At all?
At all, and I couldn't eat meat, little vegetable salads. I just had a hole in my mouth. And I was looking for a dentist, and I finally found Dr. Bobinell, and it worked out fine.
Mm-hmm. Now, you were looking for a dentist because of the problems you were having with your dentures?
Yes, a dentist that could do something, give me some implants or something. I was miserable, very miserable. All I used was powder.
A lot of denture powder?
A lot of denture powder. Oh, it would last about 3 minutes, 4 minutes, and then they'll start going back and forth, the teeth. I couldn't chew. I was very miserable.
All right, so you weren't eating the foods that you wanted to eat?
No, and then I kept sore spots from the teeth rubbing the gum.
Oh.
They were very loose. I just had a hole in my mouth. One day a lady came over to the house. She said, "Put your teeth in." I said, "They are in."
Wow.
That's right.
So the dentures were that poor fitting?
That's right. I looked about 10 or 15 years older.
Wow.
Because I didn't have any teeth in my mouth.
Even with the dentures in?
With the dentures in.
So they weren't functional?
No.
They weren't good looking?
No. You couldn't tell I had any in.
So obviously you needed to do something.
That's right.
Now, in spite of their discomfort, you wore the dentures?
Yes, because I had pride. I didn't want anybody to see me without them, and I was looking like I didn't have any in there with the men.
Okay. Now, tell us what you've got now. I guess you've got some implants and a
I have some implants and a full lower.
A full lower?
And it's wonderful.
Well, tell us a little bit about it.
Well, I can eat steak, vegetables, popcorn, anything.
You name
And
it.
I love them. I haven't stopped smiling since I got them.
Look at those teeth. The camera does not lie. I'd have to agree with that. That's great.
Yeah, I really love them.
And so you're back to the old Lou Alice.
I am back to the old Lou Alice. And I feel wonderful.
Good. You're eating the foods you want. You're
Eating
doing
the foods I
you wanna
want, doing the things I want to do. And I just look in the mirror all the time. I think I look good.
do. You do. You know that. You do. Tell us, a little bit about how you feel about having a permanent implant as opposed to something that goes in and out of the mouth all the time.
It's wonderful.
Is it like your own teeth?
Well, I feel just like I have my own teeth.
What about the cost of the procedure?
The cost isn't bad. It's worth it. To be miserable every time you eat. You can't go out to dinner. I couldn't eat the things that I liked. Mostly starches, something soft.
So any cost of the procedure then was minimal compared to the benefits that you
That's right. That's right. I really love them.
Now what about socially? You say you smile a lot more now than you ever did.
Well, I do. And I look at myself all the time in the mirror because they look good. I feel better.
There are a lot of people who are considering having their teeth removed and going to dentures. They may know somebody who has no problem with dentures and are considering it for themselves. What would you tell somebody who asked you if that's a direction they should go?
I would tell them to have implants because they don't move. They feel just like your own teeth.
What about when you first get dentures as compared to 10 years down the line?
When you first get dentures, they fit good. You can chew well. But a little later on, they get loose. You have to go and have them relined. Then they get loose again, and you have to have them relined again. finally you don't have any bone, nothing to hold your teeth in. That's where the implants come in.
So then the dental implants keep the bone from degenerating.
That's right.
Now, you do fine with your upper denture. You have an upper denture.
Yes,
The lower with the implants is permanent.
yes,
The upper is removable.
right.
But I understand that as well as you do with your upper, you're going to go ahead and have implants
That's
in your upper.
that's right.
Now, why in the world would you do that if you're doing so well with your upper now?
Because the upper is fine, but it moves, and the implants doesn't move. It feels just like your own teeth.
And is your upper, does it cover the palate? Does it cover the roof of the mouth?
Yes, yes. And the doctor's going to fix it so I won't have nothing to cover the top of my mouth.
So without that denture covering your palate, you'll be able to taste food better.
Right,
Be able to enjoy the texture better.
right.
Mm-hmm.
And I'm sure it will feel better.
Well, give us one more big smile.